Hello, my name is Fallon. I am going to be demonstrating NG tube insertion. First, I am going to verify my MD orders for the type of NG tube and for the purpose, whether it's for feeding, but the doctor has ordered it for suctioning. And I am going to take all my equipment into the room. Go into the room, knock, knock, knock. Hello, my name is Fallon. I'm going to be a nurse today. Can I get your name and your date of birth? Okay, good. Do you have any allergies? Have you ever had an NG tube before? Your doctor has ordered NG tube insertion today for gastric suctioning. First, I'm going to assess. Well, I have raised the head of the bed and I have heightened the bed up. And I'm going to assess the oral cavity and the nares for patency. Okay, have you had any nasal surgeries? Okay. I'm going to also check for a deviated septum. And then I'm going to ask the patient, after I wash my hands and put on my gloves, I'm going to ask the patient to occlude one nare. And I'm going to determine which nare I want to use. I want to make sure there's no bleeding or irritation in either of the nares. You're occluding one nare, breathe out one nare, occluding the other nare, breathe out one nare. Okay, so I'm going to go ahead and use your right nostril. And I'm going to, patient was able to cooperate, so patient has good ability to cooperate. And then I'm going to now take out my tubing. And I'm going to get my tape and measure from the tip of the nose to the ear. I'm going to go ahead and make sure my xiphoid process. Okay, so I'm going to go ahead and tape that off. Then I'm going to lubricate. 4 to 6 inches, 4 to 6 inches above the distal end of the NG tube. And then we are going to begin. I'm going to remove your pillow. And you can just rest your head back. And then I'm going to insert now. Don't worry if you have any coughing or gagging. I'm going to let you rest. And now I'm going to enter. I'm going to check for any coiling in the back of the neck. And now, I'm going to lean your head forward if you can, chin to your chest, and then if you have any gagging, I'm going to let you rest. I'm going to take it back a little bit, and then I'm going to continue to advance every time that you swallow until I reach my marker. Swallow, advance, swallow, advance, swallow, advance. Okay, now I'm going to secure the tubing. Using my already prepared tape. To the cheek. Allowing enough slack. I'm going to put it over the bridge of the nose. And then the cheek. Then can you please turn your head to this side for me? Then allowing enough slack I'm going to put the towel. The first thing I was supposed to do was put the towel. Pretending the towel was here the whole time. I would then, it has been attached to the face, and then I'm going to check the back of the throat for any coiling. Okay, I have a lot of slack in my line, and I'm going to attach it to my patient's clothing. Are you feeling all right? Okay.
The doctor's orders to see what's the purpose of the NG tube is to tie, whether it be for suction or for feeding. Then the next thing I would do is assess the patient's nares. So I'm going to look for any deviated septum.
I have fastened my rubber band.
Yeah, sure.
And then I'm going to attach, well first I will verify my plate, continue to verify my placement, and I will aspirate. I will test pH if it was hospital policy. I will aspirate 30 milliliters, and then I will reinsert contents and listen to the epigastric area for bubbling. I'm gonna go ahead and just move your gown a little bit so I can listen. Observing for bubbling, which I hear. I'm over the left epigastric area. Okay, good. Now I'm going to attach my tubing to my suction source. Dispose of all my trash. To low intermittent suction. Cover you back up. Take your towel off. Hook it up to low intermittent suctioning. And then I am going to provide oral care every 2 to 3 hours. So I'll be back and take care of that and make sure that you're comfortable. And if you have to use the restroom, and I would lower the bed, and I would keep the head of the bed elevated unless otherwise ordered. I would take off my gloves, wash my hands, and I would document the length, size, type of NG tube, and I will also document the color and consistency, which it was yellowish green, of the fluid, and then the client's response to it. The client tolerated it. And then I would also document instructions that I have given the patient, and also record on the intake and output the amount of drainage, and then any pH if it was tested.